In my grandmother's day, as I told you, when I was choosing infertility, she was telling, "Do you think you'll get any? Do you think you see one patient per day?" I think like now she's no more. But if she comes to the clinic, sometimes there's no place to sit only.
Do lifestyle factors contribute to, and how can then one improve their male factor?
Then I told him like stop all these steroids as well as this testosterone. Then he told, "Do you think really I'll father my own kid?" I told yes. And then he came back after 3-4 months, and then after stopping those drugs, and we did his count, and it was good.
Can you shed some light on how the past years have transformed and how the landscape has changed?
Now, women can choose when they want to have their kids, and I feel it empowers them about their fertility health as well. Yeah, rather than depending upon anybody else.
Hello and welcome to Fertility Tales powered by Nova IVF, where we uncover truths, break down myths, and bring expert insights. I'm your host Simrat, and in today's episode, we're honored to have Dr. Saroja with us. She is a distinguished fertility consultant at Nova IVF Fertility Hyderabad, with a rich background in obstetrics and gynecology, with over 15 years of experience. Dr. Saroja specializes in tackling complex fertility challenges, including low ovarian reserve and recurrent implantation failures. Her dedication has lit the path to parenthood for countless couples. Dr. Saroja, it's wonderful to have you with us.
It's a pleasure meeting you too, Simrat.
Doctor, let's start at the beginning. What sparked your passion to become a doctor, and especially fertility? How did you take that up?
My father was a pediatrician, and he used to see nearly 300 patients a day.
A day.
A day. And ours was a nursing home. So the clinic was in the ground floor, and we were just living above it. And even after seeing 300 patients, he used to come up. And even while he was eating, if he hear a child cry, he used to say, "Why is that child crying?" And he used to go in between his meals to go and see the child and see what happened. And for his services, he used to charge 2 rupees per consultation. And I was like not sure what to do, whether to become an engineer or a doctor. So I had a chat with him, like what is the best choice for me, or like what his impression was, or what his advice was. And what he told me was, see, if you want to earn money, if that is your only aim, you can do anything. But if you want to serve people, you be a doctor. And I was so impressed by his dedication and passion. And now I'm here as a doctor.
So you somehow followed his footsteps, and he was a guiding light for you.
Yes, and I'm really glad that I did.
How lovely.
And regarding the infertility thing, after my post-graduation, I went to UK. I worked there for a few years. Then I was posted in this fertility clinic for 6 months. We do 6 months rotation. So there we had a consultant who was very, very good. And he taught us like how you have to really speak with people, and you have to really go to that level so that you have that bonding with your patient.
Which is so important.
Which is very, very important. And one day we had one couple who were just like screaming with each other, screaming at everybody. They were so upset with everything. Then the nurse told me, okay, there is one couple who is like really unhappy with so many things. Then I told, okay, call them in. Because my consultant at that time was not there, and he was away operating. So I was doing the clinic. So after I just calmed them down and I spoke to them, and after talking to them, basically we just did basic ovulation induction. It is a simple treatment. And 1 month later, they fell pregnant, and they came back with a bouquet of flowers.
How lovely.
And the couple who was screaming and shouting, now they were so calm, and they apologized, saying that there were so many things going on in their life, and it was like 10 years of married life, and they were frustrated, and they were literally wanting to get a divorce. And after this treatment, and when I saw them so happy, I thought, okay, this is what I'm going to do to make so many couples happy.
That's truly inspiring, doctor. The field of reproduction and the field of fertility is ever evolving. Can you shed some light on how the past years have transformed and how the landscape has changed?
Truly, it has evolved a lot since the birth of the first IVF baby, Louis Brown. And now there are like so many treatments, and one of the commonly done treatment is IVF or ICSI, and we see that being done in many centers. Now it has become much safer with a very good success rates. And with this treatment, like millions of babies are born because of this treatment. And then there are like other treatments like pre-implantation genetic testing, and there are like other treatments like this PGT, what we call it as, helps couples like to screen embryos, whether there are like any abnormalities in the chromosomes or whether there is a genetic problem that can be identified. And this helps a lot of couples, like especially who are older women or who has got a genetic problem. And nowadays, like oocyte freezing is again like one of the commonly done procedures and or commonly requested procedures. So I feel this is a good change from the that has happened, because at least now women can choose when they want to have their kids, and I feel it empowers them about their fertility health as well.
Sure.
Yeah, rather than depending upon anybody else.
That's true.
So this gives them the choice to have a career, as well as, or if they didn't find the right person, to freeze
Delay their fertility journey and actually have a control over their fertility journey.
fertility journey, and that gives them immense joy, so that they can plan, and in the back of the mind they know they are safe. At least their eggs are frozen. And this similarly can be used for cancer patients, like who are about to undergo treatment for their cancers. They can freeze their eggs, and once they are cancer free and once they get the go ahead from their oncologist, they can come back and use their eggs and have their own children. And it is so satisfying to see all these things happen. And like many treatments like vitrification, there are like different treatments that has evolved over time. And with all these treatments, we are able to give much more better success rates in centers like us.
And technology has evolved to such a degree where all of these things are actually possible to this day.
Very true. Like in my grandmother's day, as I told you, when I was choosing infertility, she was telling, "Do you think you'll get any? Do you think you see one patient per day?" I think like now she's no more. But if she comes to the clinic, sometimes there's no place to sit only. So all this, and with all these advances, we are able to achieve many of their our patients' dreams, and it gives us immense satisfaction for us. Because of all this technology, we are able to help these couples.
That's true. Talking about couples and infertility, when is it said that a couple is infertile?
See, when they are trying regularly and without using any contraception for an year or so, then we call it as infertility.
Okay.
Okay, and suppose if the couples are trying for an year and if they don't fall pregnant, and we ask them to go and seek the help of a fertility specialist, especially if they are less than 35 years. But as you know, age play an important role, and the fertility decreases with the age. That I think wherever I go, I tell that message. Okay, age is very important factor that we cannot turn it back. And so if we are more than 35 years and if you are trying for 6 months, then better to see your fertility specialist because of the age.
And fertility specialist intervention, I feel, could be done much before for anybody who's trying to have a offspring. Is that correct?
It depends upon like when we need to intervene and when we shouldn't intervene. So for some people, just plain advice is what they need, all they need. So you tell them like what is the natural, because some people are not aware about their increased chances of conception in their menstrual cycle. So for some people just need education about their menstrual cycle, and when is it ideal time to have intercourse, so that it will have like more chances of pregnancy. Usually what we say, like couple of days before ovulation is better to have intercourse, and ideally like 1 week leading up to ovulation, the women have got lot chances to conceive. So such ideas, and just like telling them about like what are the methods that they can use, and just some people just need just advice regarding them. And some people, even if they don't try for a year, if they have a previous existing medical problem, we should see them beforehand. Because if some people have got severe endometriosis, there is no need for them and if they're planning for a pregnancy, there is no need for them to wait for a year to come and see a fertility specialist. It is better to come and see them, the fertility specialist, at the beginning. So it depends upon what scenario or what condition the couples have, and based upon that, we'll plan our treatment.
Doctor, the societal acceptance towards infertility has increased to quite a degree. People are coming forth to take fertility treatments and are dealing with their infertility. How do you think? Do you think in the clinic when the couples come, often the blame is still put on the woman, and how does the couple react to infertility being told to them as a problem?
Nowadays, yes, compared to when we were in medical school, more and more people are more open about their fertility problems, and they are seeking help for their fertility problems whenever they need be. And from when I was in medical school today till today, there are the accessibility of the services, especially in India, is much more. And I'm very happy to say that in India we have very easy access to a fertility clinic. Whereas in UK, where I worked before, you have to go to a general practitioner, get an appointment, and then you will get a referral to the fertility clinic. Whereas here, we get it very early on. If the couple wants to see me tomorrow, they can come and see me tomorrow. Right. So the acceptance is better. And sometimes again each couple is different. Like some people, yes, they say it is only the lady's problem and I'm fine. So sometimes you're so surprised that the couple have been married for 7 years and this guy doesn't want to get the semen analysis, saying it's all the problem lies with his wife only. So we have to convince him sometimes, saying that, okay, you please give one semen analysis. That's all you need to do. If that is good, that's fine. And then to our surprise, we have seen people not having any sperm, like what we call it as azoospermia. And that comes as a shock to some couple. And some couple are more understanding, saying that, okay, the problem can lie with anybody.
Either one of them.
Either one of them, and let's sort it out. So it depends upon, we see different ways a couple deal with their fertility problems. And understandably, because they're under a lot of stress as well. Sure. So we have to understand their stress levels, then go to each individual couple to decide and treat them in a appropriate way.
That's true. Do you see family also coming with the couple? Do you encourage that? How does that happen?
Yes. See, especially in India, we see that a lot. So sometimes they say, okay, nearly 10 people are there for one consultation. So, but initially, I'm very skeptical. I just want to see the couple alone. Because sometimes you never know what the couple is thinking. Because I had a couple, they're married for 10 years. They didn't have sexual intercourse for the past 10 years. And when the couple came to me, and that husband, he was telling me, ma'am, I have only liking towards males. I spoke to that regarding this to my father before my wedding. He told that's not possible. So I got married. So I'm in a relationship. I do all aspects. I treat my wife properly. I take good care of her. But I'm not able to have sexual intercourse with her. So this is very difficult to get if you have 10 of them sitting around you and just listening to this. So I feel first I'll speak with the couple, see what their problems is, and just check with the couple if they're okay to have them. Okay, and then afterwards I just speak in general. I call them in. I say, okay, we are going to treat them, and they are in safe hands. And hopefully next year by this time we'll get a grandkid. That's what I tell them.
Sounds inspiring, and it's also the pressure that the couple might be going through with the family around, and also the unsaid pressure of having to visit a fertility center. Doctor, for the female listeners who are seeking your guidance also, what type of tests should they undergo for a basic assessment?
See, for the basic assessment, always better to go to a good fertility specialist or fertility clinic to get their things sorted. And first of all, before the test, what I say is careful, detailed history taking, and examination will give you a clue like what their problem would be. And once we get a clue, there are like different tests that we do. First, let us start with the blood test. The blood tests tell us whether the woman is ovulating or not, or what is her egg reserve, or the numbers of eggs okay or not, or is it decreasing, or what is her hormone profile of the thyroids, prolactins, and different things we check into that. And next is ultrasound. Ultrasound is very important tool for an infertility specialist, and that give us immense knowledge of a lot of things that we would like to know. So on ultrasound examination, we will know how her uterus is, the size, her endometrial lining, how her cavities, and how her ovaries, and if the tubes are swollen, we can see it on the scan. So that, and again, the regarding lot of things, whether the uterus is normal size, or is it abnormal, or is it got smaller, bigger, less number of it. So that is gives us a lot of knowledge. And then the other test that we do is like a tubal testing. That can be done by saline infusion, sonography, or HSC, and sometimes we do laparoscopy as a test if they have like pain, or if we think there is endometriosis, like that. Sometimes just to assess, or if in HSC or something, if the tubes are blocked, we do a laparoscopy. So there are like varied tests, and it depends upon, so no size fits all. So it depends upon the patient condition and their situation. We order the test and get the
And what
results.
about male infertility? What all basic tests can they undergo to
See,
assess that?
And again, as I told you with the female, again, history taking is very important. And in males also, the main thing is the semen analysis. It is one of the easy tests to do. It is very non-invasive, and it gives so much knowledge about the male reproductive tract. So, like basically, even with the volume of semen that is collected, we will know like is there any problem, whether there is a problem with the count or the looks, what we call it as a morphology or the motility. So, semen analysis definitely gives us a lot of knowledge, and they also we order some hormone tests to know their hormone profile, and ultrasound scan to see like if there is any varicocele, whether there is how is the size of the testis, or sometimes in males with low semen count, even the cancers can be diagnosed too. So that is really helpful tests to see, and there are some genetic tests to do in men where the semen count is very less, because sometimes we see genetic problems in these men as well.
All right. Doctor, what are some of the causes of infertility in women?
There are varied causes again. So one can be like the egg reserve is coming down, and for some people the ovaries fail. So before actual age of menopause, what we call it as premature ovarian failure, and some people will have like period problems. Most common endocrine problem is polycystic ovaries that we see, especially in Asian population and especially in Indian population. Rarely we used to see it in Caucasian population. Here we see it more often. And then any tubal blocks because of any sexually transmitted diseases, or in our country, like because of tuberculosis is one of the common thing, and that can cause tubal block as well. And sometimes there are other causes like endometriosis that can cause fertility problems, or huge fibroids within the uterine cavity also can cause fertility problems.
Doctor, you mentioned PCOS. It's a common concern for every woman. What are some of the treatment options that are available today to treat PCOS?
Yeah, so first of all, polycystic ovarian syndrome is very common, as I told you. And the main thing we have to do is educate the woman, specifically with the weight. Okay, if you are normal weight, majority of the women can have regular menstrual cycles. The minute they put on weight, their periods become irregular. So first thing is manage the weight. So diet and exercise is the first and foremost advice I give to women with polycystic ovaries, because some people they're like so strong, or so they have so much willpower, or they're like so focused on getting their weight back, and the irregular periods can become regular as well. So I say, okay, it should be a balanced diet, nothing like don't
No
do too much,
extremes.
no extremes. So have everything in proper quantities, and limit the size of your portion, and do exercise. Exercise is very, very important. And because like when I went to UK like many years ago, like we never used to do that much amount of exercise, but now I see good things happening here, a lot of gyms and everything. So people are exercising, but there are many people who aren't exercising. So I focus them on like both cardio as well as muscle strengthening exercises. It is a must, at least 3 to 4 times a week. I'll ask them to do. If they're able to do daily, that's fine. They can alternate between cardio and muscle strengthening exercises. And swimming is, I tell them, one of the good sort of exercise. If you don't know to swim, just swim. Learn to swim, or if you know swimming, just go ahead and swim.
You've covered my next question also, which is about lifestyle changes that people can undertake to prevent infertility if they do not have an existing medical condition. What lifestyle changes can they actually do to become healthier and prevent infertility?
See, the first and foremost thing that the couples should be aware is pre-conception is very, very important. So if I'm planning to planning a pregnancy, 3 months prior to that, you start preparation for your pregnancy, because the health of the child depends upon what the mother is going to eat even before she conceives. So what we call it as a periconception. So we have to be very, very careful, because the environmental factors, the food that you eat can affect your oocyte as well as the sperm. And when that is so important, and once if you are doing it well, and in the long term health of your child is going to be great, so we really have to concentrate on the periconception. So my first thing is plan pregnancy. And if you have any doubts, seek a fertility specialist. And what I would say is like if you have any medical problems, optimize the medical problems, and have a plan if you fall pregnant, how you are going to treat those medical problems. And one more thing that is often neglected is immunization. Okay, like even before you fall pregnant, like better to check your rubella, because like rubella is something that if you're not vaccinated and if you get it in pregnancy, the child can have severe birth defects as well. So better to vaccinate. And another one is varicella, what we call it as chickenpox. If you're not immune, check the immunity status before, get vaccinated, then plan pregnancy. And people say your oral hygiene is also one of the important things.
How come?
Yeah, because like the gut is a thing, and many changes can happen. So better to be in fit and health before you plan pregnancy. So then you can have easy conception, smooth sailing during pregnancy, and you'll have no problems throughout your life.
That's good to know, doctor. I'm sure listeners are taking a note of this. Some couples do require some help in terms of donors. When do you think egg donor is advised to a couple?
Yes. So nowadays, our laws have changed regarding the egg donors as well. So, but the indications like why you go for an egg donor is like some people like they attain menopause beforehand, like premature ovarian failure. So for these people, their ovaries have stopped working, or have reached the menopause stage before the age of 40. So they are not able to produce their eggs. So then we go for a donor egg. And for some people, they have like, they undergo IVF cycles. And then we look at the eggs under the microscope, and then the eggs are too bad, or the embryos that they produce is not that good, or they have like repeated failed cycles. Then we say, okay, because they have failed so many cycles with their own eggs, better to go for donor eggs. And sometimes they have like major genetic abnormalities that they don't want to pass on to the offspring. So some tests, some genetic abnormalities through pre-implantation genetic testing, we can test that. But some people are not keen for that. They don't want to biopsy an embryo. So they want to go for donor egg. So in these situations, we go for donor eggs. And obviously, whenever you go for a donor egg, first of all, like even if you feel they need a donor egg, appropriate counseling is very important. And what the couple think is more important. Some people we can advise, but they don't want to do it. So then we have to go with the couple's choice and do with their own eggs. But we can tell these are the indications for the donor egg.
Doctor, talking about male infertility, do lifestyle factors contribute to, and how can then one improve their male factor?
Yeah, lifestyle factors do have a lot of role both in male as well as female fertility. So I think again like same thing, maintaining the normal BMI and compared to Caucasians, our Indian BMI should be lower compared to this. So some people, some men also, I mean, if they have their high BMI and if their sperm count is low, and suppose if they control it with diet and exercise, we have seen instances where their counts have become normal as well. So we also tell them, like some people will say we are not eating anything, but you have 4 idlis and 4 dosa, they say it is not junk food. But we all say it is junk food, so they have to. We have to really sit with them, and I think the nutritionist can help in this situation to have a balanced diet, and we can see like maintaining diet, exercise can do that. And some people they are into bodybuilding, especially men. So once I saw a man with who is like who was muscles and everything, and his sperm count was 0. So I told him, "Do you go to the gym?" And he told, "How did you identify?" I told, "Looking at you, means the build was like that." Then I told, "Do you take testosterone or steroids or anything?" And first, initially, he was hesitant to say in front of his wife. Then afterwards, when his wife went out because she wanted to go for an ultrasound scan, then he told me, "Yes, ma'am, I'm taking steroids to build my muscles." Then I told him, like, stop all these steroids as well as this testosterones. Then he told, "Do you think really I'll father my own kid?" I told, "Yes." And then he came back after 3-4 months, and then after stopping those drugs, and we did his count, and it was good. So these changes, because people don't know, going to the gym and putting on muscle alone is not important. It is like healthily maintaining your body weight. And if you're like chronic alcoholic also, it can affect your sexual function. Like you might have problems with erection, ejaculation as well. And sometimes if you're too alcoholic, the counts can go down as well. Similarly with the smokers as well. So the count, like sometimes what we call it as DNA fragments, fragmentation index go up in men who smoke continuously. And once they control that, we see good amount of changes. And with that, we see people who have like bad embryos because of the bad sperm. We get beautiful embryos with these lifestyle changes. So I definitely tell all the couples, see, some things are there in our hands that we could do, we have to do it.
Correct.
So that is something I stress on the thing. And no, like, don't take recreational drugs, obviously, and cut down that lot of caffeine and decaffeinated drinks or whatever. So maintain a healthy balance. And again, stress is one thing that we see nowadays in lot of patients. And I tell them like decreasing the stress also can improve their success rates, and they can fall pregnant naturally too. And it can increase their general health as well, like continuing decreasing the stress level.
That's so important. And the thing that you said about things that are in a couple's control, which they can have a hold over, they should definitely try that. And if there is an underlying problem, then they can definitely seek a fertility expert. But the groundwork, I think, should be done by each individual.
True, very true.
Talking about male infertility again, when do you advise a sperm donor to a couple?
Sperm donor, suppose nowadays with the advent of ICSI, even if we have few sperm, we are able to do ICSI with their own sperm. So the indications for donor have come down, but some people they don't want to go with low sperm counts, so we use donor. Or some people they have like agiospermia, means absolutely no sperm. For that we have conditions, we have procedures like testicular sperm aspiration or microteaser, and we have got procedures to obtain sperm in this situation. But in cases where we don't obtain sperm in those conditions, then donor sperm is advisable. And in some people, there is like some genetic problems in the family. And sometimes a wife is also a carrier. They don't want to pass out that bad gene to the future generations. So in that cases, they can choose a donor. And some people, they have like severe sexually transmitted diseases like HIV. They don't want to pass it on, means they don't want to use their own sperm. Then we can go for a donor sperm. And sometimes what we call it as Rh isoimmunization. Means like in our blood groups, we have like O positive, O negative, like Rh positive, Rh negative. Sometimes if the husband is positive and the woman is negative, and if they had repeated pregnancies or miscarriage, like the woman can have problems. So sometimes they want to choose a Rh negative donor, but that is very rarely used here, but we have done in some cases in UK.
Okay. Doctor, if there is an advice that you want to give to couples who are starting their fertility journey, what would that be?
So first of all, I would say like always plan ahead, and it should start. Our main aim should be a healthy mother and healthy child towards the end of the pregnancy. For that, as I told you, like planning is very important. Maintain your health, maintain your lifestyle, decrease your stress level, and seek help. See, help is available. There are like good fertility specialists who can guide you in the right path. As I told you, some people with just like simple advice on when to try in their menstrual cycle, people fall pregnant. And some people will need advanced treatments to fall pregnant. And there are like good fertility specialists as well as good clinics for them to get the good advice. And we have to know when to do what, when not to do what. So help is available. So don't sit at home, get stressed why they are not falling pregnant. I would say seek help.
Doctor, lastly, if there is any memorable incident that has highlighted the impact of your work and what you do, please share it with us.
Yes. There are many memorable events, but one I will tell you.
I'm sure.
I think like few years back, the summer was terrible, and we had conducted a camp, like an outpatient camp in a small village in northern part of Telangana. So I was very reluctant to go because like it was so hot, it was sweating, and the path was so narrow. But okay, then we thought, okay, let us do this. It is not only the normal clinics that we have to do, let's go. So we went to this far away place, and there I saw one patient who was 35 years old, who was married for 20 years, and she didn't have a child. And somebody told, these some doctors from Hyderabad came and they are conducting the camp, you go see them. So just because somebody told, she just came to visit. And I had a long chat with her. I told you, please come to our center. We'll try to sort out your problem and we'll help you. So she initially was very reluctant, but with lot of counseling, she agreed to come to Hyderabad. Then she conceived in her first cycle of IVF, and then she came back after she delivered. She told, ma'am, I came all the way with my baby. I just want you to show my baby, because if you wouldn't have come to that clinic on that particular day, I wouldn't have dreamt of coming to Hyderabad. So I would have remained childless in my life. So I thought, okay.
How heart-touching.
That was like, I thought, oh, that's great. Then from next time, I don't complain about going to...
You're able to complete so many families.
Very true.
That's it's been an absolute pleasure to talk to you, Dr. Saroja. Your insights and your stories have been just invaluable. Thank you so much for being here.
Thank you so much.
To our listeners, thank you for tuning into Fertility Tales. Remember, every journey is unique and there's a wealth of support and options available for you. Stay hopeful, stay informed, and we'll see you in the next episode. Don't forget to spread the message and like, share, and subscribe. See you next time. This is your host, Simrat, signing off.